enlargement of the soft birth canal in cattle, and instruments of obstetrical aid in cattle. So for an enlargement of the soft canal, the critical sizes of the soft canal are the vulva, the rest of the hymen, and the cervix. Incisio cervicus is done if there's a failure of the cervix to dilate of involuntary origin. It is not advised to do because the scar tissue causes narrowing. It is usually done with a scalpel or a Hetzel finger knife, and a medial superficial incision is made only along the mucous membranes and the longitudinal layer of the muscle. An epicystotomy is done when there's a failure of the vulva, vestibulum, and vagina to dilate. You can use local or epidural anesthesia, high or low caudal. And an incision is made at 12 and 2 o'clock to spare the anus. And it's 1 to 2 finger wide dorsolaterally. An incision is made on the mucous membrane only, and then you suture after delivery. For the instruments of obstetrical aid, an obstetrical snare is done for fixation, direction, and traction. An obstetrical chain is easier to clean. The short one's around 80 centimeters and the long one's 190 centimeters, and it's doubled at the end. You can also use an obstetrical traction bar, wire loops, snare introducers, and obstetrical hooks. There are round snares, flat snares, short chains and long chains, and traction bars. And you can do a simple loop, a running loop, a whip loop, and a loosening loop. There is also the Lungwitz tape for the mouth and the Gagny, and there's also one for the mandible, and the jonk is for the hind limb. There are also snare introducers and hooks.